On Friday, Multnomah County moved into phase one of reopening, and this comes despite a continued rise in cases in recent days.
Yeah, Multnomah County was the last Oregon county to enter phase one after being shut down to stop the spread of COVID-19. Well, joining us live this morning is Dr. Jennifer Vines with the Multnomah County Health Department. Good morning, Dr. Vines.
Good morning. Good to be with you.
Yeah, glad to have you on again. So Multnomah County had its first weekend back open. What were your feelings on that and how it went?
I had sort of mixed feelings. I know that business owners and the public, several people were ready to reopen. I think Multnomah County had really good plans in place, and we were really clear, I think, with the public and with our elected officials on what reopening means, which is that the virus is very much with us. Cases are going to continue to rise, and it's really now on all of us to use the 6-foot rule, the face covering, staying home if you're ill, and really good hand hygiene to keep this virus from making its way into those who are most vulnerable to being hospitalized or to dying from the virus.
You mentioned we are still seeing case numbers rising. I want to dig a little bit into the numbers here in Multnomah County. Talk us through some of the most recent numbers, and are there any trends that you're seeing that you think are positive or concerning? How are you kind of breaking down this data?
That's a great question. So again, we expect to see cases rise. I see the daily numbers. I know that occasionally we get what looks like a lot, and it takes our contact tracers and case investigators a couple of days to really dig into those numbers and understand where those are coming from. I think I'm watching hospitalizations and deaths. I think that's going to be the measure of the virus's real impact in our community. That said, I think what people may not realize is that a lot of the spread that we're seeing is from people who are getting together with family, with their close social networks. So again, just remembering it's not just reopening, it's also just reconnecting really, and making sure to take those precautions, even with people that you know well, but who maybe you haven't seen in a few months.
Yeah, there's probably a sense of, false sense of safety
Yes,
there
some
with those
comfortability.
gatherings. Yeah. I was out this weekend. I had to go to a couple stores, and there were signs everywhere talking about the face mask requirement that is coming up on Wednesday. And I will say in some of the stores, I would say half the people weren't wearing them. So what should people know, and how big of a shock is this going to be from what you've seen to a lot of people?
Mhm. I think so. The governor is going to start a mandate for face coverings in Multnomah County, among others. We're still waiting for exact details of that to come down, and we, as the local public health authority, can sort of choose how to interpret the governor's mandate. No question that wearing face coverings is really important, and I strongly encourage it for everybody. That said, not everyone can tolerate one. That includes young children. It includes people who already struggle to breathe, who can't have their nose and mouth covered. Again, we hear from Black and Brown communities that they don't feel safe covering their faces. So I think as we really promote using face coverings, we strongly ask the community also to not judge why somebody may not have one on. There may be a very good reason. And so I think there'll be more conversation about this particular mandate and the details this week.
Yeah, that is all good points to keep in mind. As we look ahead here, we're in phase one right now, and Multnomah County, Washington County, Clackamas County now going forward as this tri-county unit. I'm wondering if you can give us some insight into the conversations that you're having with those county health leaders, and what's going to need to happen here over the next 21 days to look at taking that next possible step.
Sure. So Multnomah, Clackamas, and Washington counties have always worked closely together. Our county chairs are in touch. I am in very close touch with my health officer counterparts there. Our administrators talk. So we are used to coordinating around public health issues and being in alignment, knowing that any particular issue in the Portland metro area is not going to stop at any county line. I think that said, there are several questions yet to be answered about how exactly we think about our county versus our region in the next 3 weeks as some counties prepare to move into phase two. And again, Multnomah County coming in from behind, just carefully going into phase one and seeing how that actually impacts our community. So I think we're used to functioning as a region, but the details of actually moving to phase two are yet to be worked out.
Yeah, and especially as we just continue to see these case numbers go up, I guess we'll
Yeah.
have to wait and see if that trend starts to reverse.
Yeah, I mean, overall, are you feeling good about where we're at? Just personally, do you feel safe? Are we on the right track here?
I think, again, reopening without a vaccine it means more cases. It means more spread. I expect the case counts to go up, as I've said many, many times. I think now we as a community do our best to really use the tools that we have, which I rattle off all the time. That's staying home if you're sick, washing your hands, using a face covering, and respecting the 6 foot distance, even with people that you know and love who you may not have seen.
Yeah.
So I think time will tell, but I am optimistic that we have the public health tools in place that we need to understand spread, and we'll be watching very carefully.
It really is on each and every one of us. All right,
Mhm.
Dr. Vines, thank you. We appreciate your time this morning and stay healthy.